A nonprofit labor support organization has filed a formal complaint against St. Peter's Health, accusing the hospital of hiring an anti-labor consultant to dissuade nurses from forming a union. But the hospital denied those claims in a statement to MTN. MTN's Rachel Fortunato reports.
Labor Lab has filed a formal complaint against St. Peter's Health consultant Edwards Niles Comer, claiming the consultant violated the Labor Management Relations and Disclosures Act.
Yesterday, we found out that St. Peter's Health had hired a out-of-state union buster from Florida to come in and start meeting with nurses.
Bob Funk with the Labor Lab says Comer was hired this week by St. Peter's to directly engage with nurses who are actively seeking to form a union. The complaint accuses Comer of initiating direct meetings with registered nurses, with the aim of dissuading them from pursuing unionization efforts.
LMRDA was put in place in 1959, and what it does is it guarantees all workers the transparency that they're entitled to.
Funk tells me the law is designed to ensure workers are provided with information to help safeguard their rights during labor processes. Comer is accused of violating disclosure rules by failing to file necessary reports to the U.S. Department of Labor. Labor relations consultants are required to disclose any agreements or arrangements made with employers to influence employees' organization rights. We reached out to St. Peter's Health. In a statement, the hospital denied that a violation had occurred related to hiring Comer. By law, St. Peter's Health and Mr. Comer are well within their respective timelines to file the required disclosures. This allegation is a typical union tactic to spread misinformation and discredit the employer in an attempt to gain support in advance of an election. The hospital says it is standard practice to bring in an outside expert when their employees have filed a petition with the National Labor Relations Board. And quote, St. Peter's has openly disclosed hiring a labor educator with its clinic nurses as an investment the organization is making to ensure they have access to fact-based information and making an informed decision. Labor Lab representative Bob Funk says his organization is concerned about potential misrepresentation.
The next move is they follow up with St. Peter's Health, say your consultant has to file this paperwork immediately, get it done. But we are interested in also there are civil and criminal penalties in the LMRDA for intentional misrepresentation.
You can read St. Peter's Health's full statement in this story on our website. In Helena, Rachel Fortunato, MTN News.